Welcome to today's webinar presented by SuperCoder.com. SuperCoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Next time. So I hope everyone has had a chance to print out the handouts, and we're going to go right through them in order. So I'd like to move us to the second slide as we begin. And as you can see, I'm starting off talking about standards of practice, because I think sometimes in case management we don't think about the body of knowledge that is sitting right behind our daily work and how it affects what we do and what we don't do as case managers. So standards of practice apply to all of us, whether we're nurses or social workers, and really give us definitions and a frame of reference for the work that we perform. The first standards of practice for case management were introduced in 1995 by the Case Management Society of America, and those have been updated. We're going to look at the updated version in a little bit. And as I said, these do provide you as case managers with a foundation for your practice, and this is regardless of setting or discipline. And so as we think more and more about case management across the continuum, not a hospital model, not a community model, but really how we seamlessly transition patients across the continuum, we really want to think about case management more in that generic sense in terms of applying the concepts regardless of the practice setting. So on the next slide, let's get into some of the components of the standards of practice. Those include the definition, and what I always recommend is you put your policy and procedure manuals together, that you think about having that definition of case management included in your policy and procedure manual. It's very helpful, again, to help yourself as well as those who are looking at your manual to understand exactly where you're coming from in terms of how your department functions and what it's about. You may also want to think about, and we'll look at the statement of philosophy and the guiding principles for case management. So on slide 4, we have the Case Management Society of America's 2009 definition of case management. And there are a myriad of definitions out there. In fact, I can tell you I did a lit search a couple of years ago, and I found approximately 40 different definitions of case management in the literature. They all did, however, have some common themes, and I think it doesn't matter so much which one you pick, as long as you pick one that's reflective of the work that you're doing. And I think this one is generic enough but specific enough at the same time that you can use it anywhere across the healthcare continuum. So we know it's a collaborative process. It includes elements of assessment, planning, facilitation, coordination of care, evaluation, and advocacy. We know that we deal with individuals as well as families, and we know that we provide comprehensive access to health care that is cost-effective and that promotes quality. So in any definition you take a look at, just be sure you've got those key elements included. So on slide 5, some of those pieces again. Make sure your definition is applicable in a universal manner. It shouldn't speak to a specific discipline. It shouldn't speak to only social work or only nursing, and it should not speak to a specific setting. You should also be sure you've got the process in there, and so many of us are familiar with that case management process, as I just mentioned from the previous slide, but just be sure that in your definition you've touched upon all those pieces of our case management process. What are you trying to achieve in your definition? You should have what your expected outcomes are, not down to the level of reducing length of stay, but really talking about improving quality and reducing cost. Because as we get into the specific roles in a little bit, we'll see how some of those pieces really start to fit together. All of this definition is really your foundation
SuperCoder is the fastest-growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.